what does customized treatment mean? Well, there are words like customized, individualized, and personalized treatment. What that means is every person is different in every aspect that we can think of. So if we have 20 people with cancer, the same stage, even the same age, all, or let's say most of the conditions are the same in these people. We follow protocols, we follow guidelines on what treatment we're going to recommend. But there are many factors that will make us change the treatment or give a different recommendation. So many factors, including past medical problems. If someone has had significant medical conditions or allergies to certain medications or chemicals, if they've had prior bad experiences with medical treatment, if it's drugs, chemotherapy, surgeries, radiation, immunotherapy, if they've been exposed to different situations, they may respond in a challenging way to a treatment. Their beliefs is very important too. What other medications are they taking? What other natural products or herbs are they taking? There are several factors that we need to consider when we make a recommendation. So every person is different, not only biochemically, genetically, hormonally, and their energy, and their customs on how they eat, what their cultural experience have been, geographically where they live. If they can get to the center on a regular basis, or if they live far away. So all these different factors will influence the type of treatment we will recommend. So again, we have guidelines of what we use for certain cancers, certain stages, but then we really need to customize or individualize or personalize that treatment. So that would be for the chemotherapy, the immunotherapy, the vaccines, the molecular treatments, the tyrosine kinase inhibitors, hormonal therapy, surgeries, radiation, what we recommend in complementary approaches to help in the quality of life and feeling better, coming to support groups. So again, every person is different what their beliefs. So we need to know their medical background, know the factors that are influencing them today when they need treatment, and also their beliefs and what they feel comfortable with. So we personalize the medical treatment. We also need to personalize all these different complementary approaches and integrative approaches. So one of the things that we do at our center is have multiple different complementary approaches under the integrative medicine program we have, run by 35 different practitioners of the healing arts. And someone with cancer will get to experience all of these different disciplines, complementary approaches and disciplines, and get to see what they feel better with, what they resonate with. So this is a very important question that you're asking about the customizing treatment. And every doctor, every nurse, every medical team in a cancer center needs to keep this in mind, that what we recommend for treatment would be different for the different patients, but also what we say and how we say it. If someone is from a different belief or cultural background, certain things we need to say using specific words or phrases, or the way we approach someone is so important. So that's another thing we need to individualize the way we approach different patients. And that's a skill that takes time to develop, and that's what we teach the medical students and young residents and young doctors. We remind them the importance of approaching patients differently. So in every aspect, from, as I said, the medicines, the treatments we recommend, the complementary approaches, but also the way we approach someone. Some patients want to be hugged, they want to be held, they want us to hold their hands, and others want to stay at a distance. And we need to respect that. We need to respect every person and what their customs are and what their true desires are. So that's part of being innovative. So fortunately, medicine is evolving to understanding all these things, where for us to be innovative, we need to keep in mind all these different factors. And personalizing, customizing, individualizing treatments in a setting of centers where there is an optimal healing environment for everybody. Number one, for the patients, then for the staff, the nurses, all the employees, the medical assistants, the receptionists, the lab technicians, the researchers, the doctors. There needs to be a nurturing environment for everyone. And that's the good news that we're seeing in medicine, is this evolution to a more optimal healing environment, understanding that we need to bring together the best that medicine and science has to offer with all these different complementary approaches in an innovative setting, and also remembering to personalize and individualize the treatment for each person.